Welcome again. We are talking about the respiratory system development. In this section, we'll deal with trachea, the bronchi, and the lungs. We'll see how the development of trachea takes place from the respiratory diverticulum. Then we'll follow it to the formation of bronchi, and finally we'll see how the lungs are being developed from that respiratory diverticulum. The trachea develops from the part of laryngeal-tracheal diverticulum, which lies between the pharynx and the point of division of the diverticulum into the bronchus. Okay, it's a big statement. Now, don't focus on the statement, focus on the figure. So, this is the foregut. This in pink is the foregut. This in blue is the laryngeotracheal tube or the laryngeotracheal diverticulum. This in brown is the splanchnic mesoderm. Alright. Now this tube is being divided into the tracheal buds. Here you can see two tracheal buds are being formed. These tracheal buds are now expanding and forming the bronchial buds. So the development of trachea is as simple as that. The development of trachea takes place from this laryngeotracheal bud or the respiratory diverticulum, but from which portion? The portion which lies between the pharynx, this is the upper portion of the pharynx, and the point where it divides into two buds or the bronchial buds. So these are the bronchial buds. This is the trachea. So the upper portion was pharynx, the lower portion, the lower two divisions were the bronchial buds. In between this upper portion and these lower divisions lies the trachea. Simple. So, endoderm of the laryngeotracheal diverticulum. It forms the lining epithelium and the glands. So we are seeing this throughout this respiratory system, the endoderm giving rise to the endoderm of the adult structure. So the endoderm of the laryngeotracheal diverticulum forms the lining epithelium and the glands of the trachea. The cartilage, the muscle, and the connective tissue of the trachea, they come from the surrounding splanchno-pleuric intraembryonic mesoderm, which surrounds the laryngeotracheal tube. So this splanchnic mesoderm, this in brown, which was surrounding this tube, again this is surrounding this tube, is responsible for the production of these cartilage, the muscle, and the connective tissue component. So this is true for the entirety of the respiratory system. The endoderm of the respiratory bud is responsible for the production of the endoderm and the glands of the adult structure, and the cartilage, the muscles, and the connective tissue are contributed by the splanchnic mesoderm. So now we see the bronchi. So the trachea has been formed. Now the trachea divides into the bronchial buds. This is by the end of the 4th week. These are the bronchial buds. These are two bronchial buds being formed, the right and left bronchi. They further subdivide into the formation of further generations of the bronchi. We'll see how that happens. So the two primary divisions of the caudal part of the respiratory diverticulum. So this is the caudal most part, cranial towards the head, caudal away from the head towards the feet. So the lower part of the this respiratory diverticulum, it forms the right principal bronchus and the left principal bronchus. So you can see the right and left principal bronchus being formed. So the principal bronchi then divide into the secondary bronchi. So you can see here the secondary bronchi are being formed, 3 on the right side, 2 on the left side. Now these secondary bronchi, they further subdivide into lobar bronchi, which supply a separate lobe, then segmental and intrasegmental bronchi that go into the segments and within the segments respectively. Moving on, we have these lobar bronchi, they undergo progressive branching. These are the lobar bronchi which are undergoing progressive branching. They almost form 10 segmental bronchi. This is at about the time of 7th week of intraembryonic life. So these segmental bronchus with its surrounding mass of the mesenchymal tissue, this is a segmental bronchus with its surrounding mass of this mesenchymal tissue in purple or gray, whatever you may call it, forms the bronchopulmonary segment. So, what is a bronchopulmonary segment? Bronchopulmonary segment is a segmental bronchus with its surrounding mass of mesenchymal tissue. So, what is happening? Now, let's recap. First, there was a respiratory diverticulum. The upper portion of the respiratory diverticulum formed pharynx, larynx. Then there was trachea. Trachea divided into two: the right and left principal bronchi. The right principal bronchus divided into three divisions. The left principal bronchus underwent two subdivisions. Now, each principal bronchus divided into a secondary bronchus. This secondary bronchus further divided into lobar bronchus, segmental and intrasegmental bronchus. Now this lobar bronchus, it underwent progressive branches to form the segmental bronchi. They form almost 10 branches. These are the 10 segmental bronchi which are formed in the lung bud. This is at about 7th week of intrauterine life. Now, bronchopulmonary segments are formed within the lung. What is a bronchopulmonary segment? Bronchopulmonary segment is a segmental bronchus with its surrounding mass of the mesenchyme. Alright, I hope you understood it. Now, each lung has 10 bronchopulmonary segments. Because 10 segmental bronchi were formed, so each lung has 10 bronchopulmonary segments. So, this is what a lung at 8 weeks of development looks like. This is the tracheal tube. This is the left principal bronchus dividing into two branches, the secondary bronchi. The secondary bronchi then further divide into lobar bronchus, the lobar bronchus segmental, and then intrasegmental bronchus. Again, on the right side, we have three. This is the principal bronchus, dividing into upper segmental bronchus, middle segmental bronchus, and the lower segmental bronchus. Each bronchus now further subdivides into lobar, segmental, and intersegmental bronchus. All right. So this is what a lung looks like at 8 weeks of development. So by the end of 6 months, 17 generations of bronchial subdivisions have been formed. So the bronchi keep on dividing till 17 subdivisions are formed. Before the bronchial tree reaches its final stage, about 6 to 7 divisions take place after birth. So when a child is born, its lungs are not completely formed, but 6 to 7 divisions take place after birth. Now, from the distal part of the bronchial tree, which consists of bronchioles, respiratory bronchioles, and alveolar ducts and the alveoli. Now, these 6 to 7 divisions which occur after birth and the distal part of, they form the distal part of the respiratory tree, and the distal part consists of the bronchioles, the respiratory bronchioles, the alveolar ducts, and the alveoli. So, in this figure, it's a recap of how the development of lung was taking place. So, here we can see this was the foregut, and this in blue is the laryngeotracheal tube. Now, this laryngeotracheal tube develops into the larynx and the trachea. Now, this trachea that has been developed divides into tracheal buds. Now, these tracheal buds are undergoing elongation and differentiation. Now, the adult trachea has been formed and the bronchial buds have been formed. These bronchial buds divide into the now the trachea bifurcates and these bronchial buds divide into the primary bronchi. Now these primary bronchi, they undergo further subdivisions to form the secondary bronchi. These secondary bronchi are result in the form, they undergo further subdivisions to form the lobar bronchi, the segmental bronchi, and the intersegmental bronchi. So I've already recapped this entire section. In this section, we talked about the development of the trachea, the bronchi, and the lungs, we saw how bronchopulmonary segments, which were, what were they? They were segmental bronchi along with their mesenchymal components. How did they develop? Each lung had had 10 bronchopulmonary segments, because 10 segmental bronchi were formed in each lung. It is very easy, though it sounds as a mouthful. I hope you understood it. If not, watch it once again and you'll understand it completely. Keep watching sqadia.com.